Imagine the outrage boiling over as a beloved public broadcaster like the BBC dips into taxpayer-funded coffers to lavish perks on its employees that everyday folks can only dream of. It's a scandal that's sparking heated debates about fairness and priorities in the way we fund our media, and trust us, this is just the tip of the iceberg when it comes to questions about who really benefits from your license fee payments. Let's dive into the details. The BBC is gearing up to shell out a whopping £650,000 of license fee money, those mandatory fees that UK households pay to fund public broadcasting, for a private healthcare initiative tailored exclusively for its staff. This isn't just any medical plan, it's a contract set to provide remote GP appointments, accessible either through online platforms or phone calls, for both permanent employees and those on fixed-term contracts. To put it simply, GPs are doctors who offer general medical advice, and this setup allows BBC workers to consult them virtually, bypassing the traditional in-person visit. The tender for this scheme has already been announced, with the service slated to kick off in February 2026 and run through January 2029, with a potential extension all the way to 2031. For beginners wondering about the license fee, it's essentially a tax collected from TV owners to support the BBC's operations, covering everything from news to entertainment. But here's where it gets controversial. Critics are absolutely furious, labeling this move as indefensible and clamoring for the license fee to be abolished altogether. Picture this: while ordinary citizens are grappling with excruciating delays to see a doctor through the National Health Service, NHS, the UK's public healthcare system, the BBC is essentially fast-tracking premium access for its team. A source from the TV industry didn't mince words, saying, "When the public can't get a GP appointment no matter how hard they try or how much they pay, our license fee is funding BBC staff to get one whenever they please." It's utterly ridiculous. This isn't happening in a vacuum. Just last week, shocking revelations emerged about the state of NHS appointments. Data analysed by the House of Commons Library, based on NHS England statistics, showed a staggering 12.9 million people endured waits of more than 28 days for a GP slot in the first half of this year, up dramatically from just 4.5 million back in 2021. To give you a clearer picture, that's like waiting over a month just to chat with a doctor about a health concern, which can be incredibly stressful for someone dealing with an illness or injury. And it doesn't stop there. The NHS has also issued warnings that for non-urgent treatments requiring specialist consultants, think things like seeing an orthopedic surgeon for a joint issue, patients might face up to 18 weeks from booking to actually getting the appointment. This means people could be in pain or uncertainty for months, all while the BBC plans this lavish perk. William Yarwood, the media campaign manager at the Taxpayers Alliance, a group advocating for taxpayer rights, weighed in strongly, "It's outrageous that while millions of people can't get a GP appointment, the BBC is using license fee cash to fund a private healthcare service for its staff. This kind of two-tier system, where viewers are forced to pay for luxuries they can't access, shows how out of touch the BBC has become. The license fee should be scrapped. It's indefensible to keep squeezing struggling households to fund this." Now, to add a bit more context and help you picture the scale, imagine if you were a BBC journalist working irregular hours, say, covering late-night news stories or events in remote locations without easy hospital access. The organization argues this remote GP service is a vital part of their duty of care, aimed at keeping staff healthy, reducing days off sick, and ensuring they can keep delivering high-quality content for audiences worldwide. A BBC spokesperson explained, "As a 24/7 global media organization, many of our teams work irregular hours and in locations where NHS access is not available. We provide remote GP access as part of our duty of care, to reduce sickness absence and ensure we can continue delivering services for audiences. And this is the part most people miss. Is this a reasonable perk for a workforce keeping our airwaves alive, or is it a blatant misuse of public funds that widens the inequality gap?" Some might argue that investing in employee health is smart business. After all, healthy workers are more productive, and in a high-stakes industry like broadcasting, that could translate to better shows and news for viewers. But others see it as elitist favoritism, especially when NHS struggles are front-page news. What do you think? Should public money go toward such perks, or is it time to rethink how we fund institutions like the BBC? Do you agree with scrapping the license fee, or is there a middle ground? We'd love to hear your thoughts in the comments, share your opinions and let's spark a real conversation.